Hello. Let's see, last time I showed you the muscles that were on the inside of the sartorius, from the sartorius to the gracilis. We went over all these muscles. Now if you remember the muscles that I showed you to use as reference points, here is the gracilis that runs along the inside of your inner thigh. Your gracilis makes you graceful. So here's the gracilis. And then over on the other side of the leg, on the lateral side, here is the tensor fasciae latae, right here. And that merges into the iliotibial tract that runs alongside the lateral section of your thigh. And they all insert into the tibia down here. And then finally, the sartorius, which attaches on the ilium and then crosses over the femur from the lateral side to the medial side, and once again attaches to the tibia. So here's the sartorius, and we did the muscles on the superior medial side of the sartorius. Right here. Here's the iliopsoas, the pectineus, and the adductor longus. So now we're going to do the muscles on the lateral side of the sartorius. All of these right over here, which there's only 4 of them. And together they're called the quadriceps. And quad means 4, so that's why they're called the quadriceps, because they're a group of 4 muscles. One you cannot see. There's one laterally right here, if you can see that, and that's on the lateral side. There's one on the medial side. And there's one going straight up and down right here. This whole thing is one muscle. And then there's one beneath, deep to this middle one, in between the lateral and the medial muscle, and it's underneath this middle muscle right here. So that's 4, and they're called the quadriceps. Okay, now first, a little bit of Latin. Vastus, if that looks familiar to you, in English we use the word vast a lot, meaning very large, very big. And that's what vast means. So vastus is going to mean a big muscle. So there are 3 vastus muscles. There's the vastus medialis. And where do you think that's going to be? That's right, that's going to be on the medial side of the leg, of the thigh. There is the vastus lateralis, and that's going to be on the lateral side of the thigh. And in between those two is the vastus intermedius. And remember, inter, I-N-T-E-R, just means between. So between the two, medial and the medialis and the lateralis, is the intermedius. So these are all vastus muscles. So let's look at the vastus medialis. The vastus medialis is obviously on the medial side, and that is this muscle right here. And it's a big muscle. You might not be able to tell from this picture because it's covered up by other muscles, but this is on the medial side of the thigh, and it is right inferior to the sartorius, and that's the vastus medialis. And then there's the vastus lateralis. Let's go out to the lateral, because that's going to be the big muscle on the lateral side of the thigh. Runs all along down here. It's inferior to the sartorius, and it's right next to the iliotibial tract. The iliotibial tract is the only thing that more lateral than the vastus lateralis. And then, now you would think that the vastus intermedius would be this muscle right in between the lateralis and the medialis, but it's actually beneath this muscle. This muscle that goes straight up and down, see there's the lateral muscle, the vastus lateralis, there's the medial muscle, the vastus medialis, and then this muscle that goes straight up and down the thigh, this is called the rectus femoris, and it goes all the way down to the tibia. This is called the rectus femoris. Now femoris, because it's in front of the femur, that's the nearest big bone is the femur, and rectus just means straight up and down. So rectus femoris is this middle muscle that goes straight up and down in between the vastus lateralis and the vastus medialis. Now, so if those are the three that you see, where is the intermedius? Well, the intermedius, the vastus intermedius, lies between the vastus medialis and the vastus lateralis, but it lies beneath the rectus femoris. So I'm going to put VI for vastus intermedius deep, because it lies deep to the rectus femoris. It's underneath here. Now they all connect at different parts up at the origin points, but every single one of them ends up at the tibial tuberosity. See, the vastus lateralis comes all the way down past the knee down to the tibia, and remember where the tibial tuberosity is? It's right below the knee, on the front of the tibia, the anterior of the tibia. So the vastus lateralis comes down here, the vastus medialis comes all the way down to the tibial tuberosity, the rectus femoris comes all the way down to the tibial tuberosity, and the vastus intermedius comes down to the tibial tuberosity. So they all insert, their insertion point is at the tibial tuberosity. So that's easy to remember for their insertion points. All four of them insert in the tibial tuberosity. Now let's look on the 3D model. Just for your points of reference, those reference muscles are, here's the tensor fasciae latae, and I still say that reminds me of ordering a cup of coffee at Starbucks. Here's the iliotibial tract that runs all the way down the lateral side of the thigh. Here is the gracilis that runs all the way down the inside, the medial side of the thigh. And here's the sartorius that starts on the lateral side of the hip, crosses over the femur, and ends up on the medial side of the tibia. Now, the muscles that we're looking at are the vastus medialis, and that's this one here, and it goes up further. It's just covered up by the sartorius. The vastus medialis. Here is the vastus lateralis. And see, this goes all the way up on the lateral side. The only thing more lateral on the front of the thigh is the iliotibial tract. Other than that, the vastus lateralis is the lateral muscle on the anterior thigh. And then in between the two, there's the rectus femoris that goes straight up and down in between the two. And if you remove some of these layers, you can see underneath the rectus femoris and the vastus lateralis is the vastus intermedius. See, here's the vastus medialis, and here's the vastus intermedius. And if you cover those up, then this is the vastus lateralis and the rectus femoris. Now, the vastus lateralis, the one that goes on the lateral side, attaches at the greater trochanter, which is this high section of the femur right here, the greater trochanter, and it also attaches, the vastus lateralis also attaches at the linea aspera, this line right here going up and down the femur in the posterior part of the femur. So the linea aspera in the posterior femur and the greater trochanter, that's where the vastus lateralis starts. That's its origin points. It has two of them. And then it comes all the way down and it attaches down here. It's cut off by the picture. But if you would follow this down to the tibia, right below the patella, the tibial tuberosity is right down here. So the vastus lateralis originates at the greater trochanter and the linea aspera. So it has two origination points. And then it comes down here, and this picture kind of cuts off, but it goes down here to the tibia and the tibial tuberosity, which is down beneath the knee. Now the vastus medialis, the one on the inside of the thigh, it also originates at the linea aspera. But just that, just the linea aspera. So the lateralis has two origin points at the greater trochanter and the linea aspera. The vastus medialis just originates at the linea aspera, and it wraps around the lateral side of the bone of the femur, and it comes down to the tibial tuberosity. All four of these muscles all insert at the tibial tuberosity. They just have different origin points. Now the vastus intermedius just originates at the body of the femur. The vastus intermedius, the one you cannot see without removing the rectus femoris, the one underneath the rectus femoris, it just attaches right along here at the body of the femur. And then it extends down and inserts at the tibial tuberosity. And then the rectus femoris, the one that goes over that, it originates all the way up here at the anterior inferior iliac spine, right here. Remember that spine, that little bump that comes out of the ilium? Well, it originates right here, the rectus femoris, and it goes all the way down to the tibial tuberosity, because as I said, they all insert at the tibial tuberosity. So let's see those attachment points. So the vastus lateralis, the one that's the furthest outside laterally, attaches up here. See this little line on the greater trochanter? It attaches right there at the attachments of the vastus lateralis. And it also attaches at the linea aspera. And then the vastus medialis, the one on the inside of the thigh, attaches to the linea aspera. Here's attachments of the vastus medialis. It wraps all the way around the inside of the thigh and then comes down to the tibial tuberosity. And then the vastus intermedius, the one in between those two, attach on the body of the femur, right here. This big attachment, This is all the origin for the vastus intermedius. And then the vastus intermedius comes down and inserts into the tibial tuberosity. And then finally the rectus femoris, the one that goes on top of the vastus intermedius, attaches up here at the inferior anterior iliac spine, comes all the way down the femur. It doesn't attach to the femur at all. The rectus femoris, ironically, it's named after the femur because it runs up and down in front of the femur, but ironically, it doesn't touch the femur at all. It attaches up here at the ilium, and it inserts down here at the tibial tuberosity. So let's see those muscles one more time. So here would be the vastus medius right here. Here's the gracilis that runs along the inside of the thigh. The sartorius would be running along right here. Here's the vastus medialis. Here's the vastus intermedius. And then let's put some more layers on that. Here, once again, vastus medialis. And we don't see the vastus intermedius anymore now that we put the other layers of the muscles on top of that. So here's the vastus lateralis, because it's lateral. And here is the rectus femoris. And the rectus femoris, the one named after the femur, is the one that doesn't touch the femur. It attaches up here at the inferior iliac spine, and it goes all the way down and inserts at the tibial tuberosity. And just as a reminder, here's the knee joint. Here's the vastus intermedius. See the vastus intermedius, the one that connects all along the body of the femur? That comes all the way down, and it attaches at the tibial tuberosity. Here's the vastus medialis, comes all the way down and attaches at the tibial tuberosity. And here's the vastus lateralis, comes all the way down and attaches at the tibial tuberosity. And here's the rectus femoris. And these all merge into this tendon, the quadriceps tendon, but I don't think you need to know that for the muscles exam. But just so you can follow along the picture here, that's why when I highlight the rectus femoris, it ends up here. It just turns into the tendon, to the quadriceps tendon. They all merge, all four of the muscles merge into this quadriceps tendon and come down and insert down here at the tibial tuberosity. So let's take some layers off of here and see and look at the tibial tuberosity just for a refresher. See this rough area right here, right beneath the knee? That is the tibial tuberosity. And again, the tuberosity and trochanter and all the T words except for transverse that means it's a rough patch on the bone where a bone inserts into it. And here's the tibial tuberosity. See how this is all rough right here? So this is the insertion point for all four quadriceps. The vastus medialis, the vastus intermedius, the vastus lateralis, and the rectus femoris. They all insert into this one place. So you only have to learn one insertion point for all four of the quadriceps. Okay, so let's draw it out so we don't forget where all these are. First, let's get in there those three reference muscles that I told you about. There is the iliotibial tract that comes down, runs alongside the outside of the thigh, and inserts into the anterior lateral condyle of the tibia. There is the gracilis that comes down on the inside of the thigh and inserts in the medial tibia, medial shaft of the tibia. And then there's the sartorius, which comes down laterally and then crosses over the femur and comes down and inserts medially into the same point that the gracilis does. Now, between the iliotibial tract and the sartorius, there is the vastus medialis, which inserts on the back at the linea aspera, and the vastus medialis wraps around the inside of the femur and comes all the way down and attaches at the tibial tuberosity right here. And vastus means large, and medialis means it's on the medial side of the body. So here's the vastus medialis. Now the vastus lateralis inserts up here at the greater trochanter and also comes down the lateral side of the body next to the iliotibial tract, and it inserts into the tibial tuberosity just like the vastus medialis does. And this is the vastus lateralis, vastus meaning large, lateralis meaning the lateral part of the thigh bone. And then attaching at the body of the femur right here, right all along here at the body of the femur, is the vastus intermedius. Intermedius, inter meaning between. So between the two other vastus muscles. This is the vastus intermedius, and comes all the way down to the tibial tuberosity. These all insert into the tibial tuberosity, same place. And then on top of that vastus intermedius, connecting at the anterior inferior iliac spine and coming all the way down beneath the sartorius, and it covers up the vastus intermedius and goes all the way down and also attaches at the tibial tuberosity. So see, once this vastus femoris is in place, you cannot see the vastus intermedius because the vastus intermedius is deep to the rectus femoris. So once again, just to look on the back, this is the posterior view. The rectus femoris originates in the front of here. You can't see it because this is the posterior, but the rectus femoris originates at the anterior inferior iliac spine, and it goes all the way down. You can't see it because it's in the front. Goes all the way down to the tibial tuberosity in the front. Now the vastus lateralis has two origination points. One's at the greater trochanter up here, and the other is at the linea aspera right here. So the vastus lateralis originates here and here, and it wraps around laterally around to the front. And then it goes down in the front, down to the tibial tuberosity. Now the vastus medialis also originates at the linea aspera, and it just has that one origination point. The vastus medialis originates at the linea aspera. It wraps around medially around the femur into the front, and then it goes down and connects to the tibial tuberosity. And then you have the vastus intermedius, which lies between the vastus lateralis and the vastus medius and beneath the rectus femoris, but that is totally on the front side, so we're not going to see this posteriorly at all. Now, a word about the quadriceps, and that's what we've been studying, the quadriceps. Quad, because it means, quad means four, so quadriceps are the four big muscles in the front of the femur. Now, if you notice, the vastus lateralis attachment at the greater trochanter and at behind the bone at the linea aspera wraps around front and comes down to the tibial tuberosity. The vastus medialis starts at the linea aspera as well, but it wraps around medially and comes down to the tibial tuberosity. The vastus intermedius starts in the body of the femur right here, and it comes down and attaches to, you guessed it, the tibial tuberosity. So look at those three muscles right there. They all attach right around here at the top of the femur, and then they attach down here at the top of the tibia. So what do you think the actions are going to be for these muscles? Well, if these muscles shorten, it's going to pull down here, it's going to pull on right beneath the knee joint. So it's going to straighten your leg out, it's going to unbend your knee and straighten your leg out, and that's called extension. Now remember, flexion is bend, to flex is to bend, and to extend is to straighten. So this is an extension because, here you go, say you're sitting down and here's your thigh and here's your knee, here's your foot, and here is where all these muscles are attaching, right up here at the top of the femur. And then they run all the way down and they attach right here, right beneath the knee joint at the top of the tibia. So when these muscles shorten, it's going to raise the lower leg up so the leg is straight, so the knee is not bent anymore and the leg is straight. And that's what's called extension. Now, what about the rectus femoris? Well, the rectus femoris does the same thing, but it has an added action to it, because the rectus femoris also attaches down here at the tibial tuberosity. It goes all the way up. But the rectus femoris attaches up here in the iliac spine, in the inferior iliac spine. So the rectus femoris does its action, it does do the extension of the knee, but it also does the hip flexion, because see, it's attached up here at the hip. So when you're standing, let's see, here's the butt. This is a lateral view. Here's the knee. When you're standing up, see, the rectus femoris is attached up here and goes all the way down to below the knee. So when this shortens, Not only does it make sure the knee's straight, here's your pelvis right here. So when this rectus femoris shortens, it also will raise the upper thigh. It'll bend the upper thigh up until you can sit down, until it's in a sitting position. So see, this upper thigh, this thigh will bend like so you can sit down. It will raise up and it will flex, because flex means bend, right? So this will bend your thigh at the waist, like when you're sitting down, or if you're doing leg lifts or something in the front. That's an added action to the rectus femoris. So the rectus femoris has hip flexion, and remember, flexion just means to bend. And then all quadriceps, including the rectus femoris, has knee extension. And extension just means to straighten. So they all help straighten the knee out, but the rectus femoris also bends your thigh at the waist.